Hey guys, Brian Soliday. Today I wanted to go over stuff that you're going to want to use for an evaluation. You want to so equipment that we're going to use for an evaluation, not stuff, but there's equipment we want to use when doing evaluations for ourselves. We want to find a baseline when starting a program where we are body fat wise, muscle wise, flexibility, and our blood pressure. So I'm going to go over a few simple things that we can use to determine where you are if you're first starting an exercise program, or if you've been doing one for many years and it's important to monitor yourself to see where you are. So the first one you're going to want to have is you want to have a blood pressure cuff. You can find a blood pressure cuff, a talking one, and you want an automated one because it's easier to do on yourself. You don't have to set it up, have somebody else take it for you. For the blood pressure cuff, it's one that I got on Overstock.com. I can't remember. I think it was like $25, but it's reliable and it works. So what you're going to do is when you set it up, you're going to want to find where it says, where is the line? If I can find it. Okay, where this line is right here, where my finger is, where this line is, you want to match that up on your brachial artery. Now your brachial artery is an artery on the inside of your arm. So you're going to want to line it up with that. So I'm going to line it up. I'm going to line it up with that. Putting it on. Now when we put it on, we want to have it up at heart level. And that line that I showed you is going to be lined up right there on the inside. And we want to have a little room from our elbow for the blood pressure cuff. You don't want it exactly right here on the elbow. You want a little room. Okay? You want to have your fingers loose, not fist. Okay, we want it up at heart level. When you take it, you want your feet flat on the floor. Oops. Hold on. Alrighty. Sorry guys. You want your feet, there we go, get you set, sorry about that. You want your feet flat on the floor, and we want the cuff up at heart level. When we set this up, there's a start button right here. You'll hit the start button, but before you do that, there's a little, right here where my finger is, there's a little hole, and that's where this is going to go. You'll put that right here in this, and then you'll hit the start button. Now I'm not going to hit it, but when you hit it, make sure your arm is on something like a desk or a table, so it's nice. It's nice and made sure at heart level. Okay, so that's the blood pressure cuff. Once you hit the start button, it's gonna say hello, and then it's gonna talk to you. Then it's gonna pump the cuff up. It's going to pump the cuff up, and it's going to come back down, and it's going to give you a reading. What's great about it is it's automated, so it's consistent. It gives you the same reading each time. You don't have to do it you don't have to have someone else take it for you. And also it has big numbers on it, so if you're an older individual that has low vision, you're able to see it. And it also reads it out to you as well at the end. It'll say it to you. It'll give you your systolic, the big number, the diastolic, the smaller number, and then it'll give you your heart rate. So when you see it, you want to be around 120 to 80 is always the common one, like the textbook one you shoot for. Once you start getting a little over 120 for the top number, that's a little high. And once you start getting over 80 to 89, you're getting a little high. For the diastolic. Systolic is when the heart is contracting, it's pushing the blood through, and diastolic is the relaxing phase. And then it'll also give you your BP, it'll give you your heart rates, your beats per minute. And you want that to be at rest between 60 and 100. Make sure when taking blood pressure, you rest 3 to 5 minutes before taking it. Getting up and walking from the couch to get something to eat from the kitchen, and then using the bathroom is enough to elevate your heart rate to affect it. So make sure not to take it before you haven't rested for 3 to 5 minutes. So that's number one. The second one is a BIA scale. Now BIA, this is also I got over Overstock.com. It's verbal, so it talks to you, and this is great because it gives you your weight and your body fat percentage. Now body composition is our muscle, bone, fat. So it's all of that combined. It's not just our weight. So we're more concerned about our percent body fat versus our actual body weight. If we are 150 pounds, but we have 45% body fat, that's really bad. But if we're 145 pounds or 150 pounds and have 10 to 11% body fat, that's really good. So you're going to want to use this to monitor your weight. You can, like I said, you can get this on Overstock.com. If you're lower vision or not, it's great because it tells you your reading. What you'll do is a BIA. How it works is it shoots a little electrical impulse through your body. Don't worry, you're not going to feel anything. But what BIA is it's a way to it's the electrical stimulation that you shot through your body that determines your body fat percentage by any resistance through your blood, muscle, bone, fat, anything like that. The resistance it gets is how it determines your body fat percentage. So when you set it up, you can set it up for up to 10 people. So you'll see a beginning number when you start at 1, and then it goes up to 2, 3, 4, 5, 6, 7, 8, 9, 10. So you can have up to 10 people. So if you have your wife or husband, when you use it, you can have 1 and 2. You can have 2 different settings for you guys. So what you'll do is you'll set it up. You'll push on it. It'll say hello, and they'll say 1. And that 1 is the top setting. So you're the first person. So you're going to hit start. After you hit start, for the 1, it's going to give you a person. It's going to give you an athletic person, a runner, or it's going to give you a sedentary person, a normal person. If you're sedentary, you'll hit this. You'll hit sedentary, or if you're athletic, you'll hit the right arrow, and then it'll move you to the athletic person. Then you'll hit start again. Then it'll give you male or female. It'll give you a little picture of a guy and a little picture of a girl. If you're male, just hit the start. If you're female, just hit the right button. It'll move it down to female, and then you'll hit start again. Then it'll give you, and then it'll ask you for your height. And for your height, you'll move up to the right to increase the height. You'll go to hit the right one, and for the left to go down, you'll hit the left one. After you get the right height, you'll hit start. Then it'll give you your age, and you do the same thing. Up is right, down is left, and then start. And you're going to want, after that goes away, you're going to hit it once, give it a second, and then hit it again. Then it'll say goodbye. Then when you get set, you'll set it on the floor. Try to use concrete or tile because I found the little electrical paddles don't work quite as well on carpet. So make sure it's a nice flat surface. Concrete, tile, wood, that'll work too. Step on, place your feet here and here. It'll say hello, and it'll say 1 because you set it up as 1. Once it says 1, you'll step back off. Then it'll say ready. When it says ready, you'll step back on, placing your feet here and here. And then it'll go quiet for a few seconds, and then it'll beep, and it'll give you your weight and your body fat percentage. So it's a good way to manage your body fat percentage so you know where you are in determining if you need to lose a little weight or if you're doing just fine. So that's a real simple thing. Both the blood pressure cuff and the heart rate scale, or I'm sorry, the weight scale you can get on Overstock.com, and there's two great things to: 1, monitor your weight and your body fat percentage, and then also monitor your blood pressure. One thing I did want to mention to you, I almost forgot, is if you're doing blood pressure and you're on hypertensive medication, high blood pressure medication, your reading will be affected, or any medication that affects your heart rate, that will be affected too because it gives you your heart rate as well. So keep those in mind if it does. Yeah, if you get a higher reading on the blood pressure cuff, remember, don't freak out because you may have been just walking around and you forgot to rest or something like that. If you have no history of high blood pressure, you have to take it 2 times a day, once in the morning, once in the evening, for like a week or 2 before the doctor will really say, okay, you might have hypertension, and then they'll kind of go from there. But if not, just because you always want to take it. If it's higher than normal, take it at least twice, and make sure you rest 1 to 2 minutes in between taking the blood pressure. The last one we're going to do is waist hip ratio. So your waist and your hips, your waist hip ratio, and this is a good determination of how to determine if we are holding excess body fat, if we're more prone to obesity, which can cause which some of the bad things are strokes, hypertension, cardiovascular disease, anything like that. It's a precursor to, so it's a good thing to monitor, and all you need is a simple tape measure. So I'm going to use this one. This is the one I use on my clients, so it's slicker. It's not as stretchy like some of them have a little pin or a little pin on the side, and they expand kind of like a tape measure. They shoot out, and that's a better one to have because you can lock it in place. This one's not a stretchy one, but it'll work. This is harder to use on yourself versus doing it on somebody. So if you have someone that can do it on you, great. If not, try to get, you can do it with one like this, but if you can get like a spring-loaded one, it's easier. So we're going to do your waist first. When you do your waist, you want to shoot for the smallest point between your zygomatic process, the bottom of your rib cage, and the top of your belly button, the smallest point. Okay, so I'm gonna just not try to get an accurate thing. I'm just gonna try to get it held so you guys can see. But you want to get the smallest point, okay, for the waist between your zygomatic process, the bottom of your ribs, and your belly button. Once you do that, you're going to go down to your hips, and you want to get the biggest portion of your hips, the biggest part around the buttocks for the hips, and then you'll reset, and you'll do it again and again. Now, a few things when you do this. One, if you have a variation of more than 1 centimeter, because you're going to want to take it twice. Take both readings twice. Take the waist twice and the hips twice. Not in a row. Go waist, then hips, waist, then hips. Make sure you take it that way. Don't go waist, waist, hips, hips. Go waist, hips, waist, hips. If you have a bigger than 1 centimeter difference in the waist first time and the waist second time, or the hips first time and hips second time, you have to redo it twice again. You don't want any greater than 1 centimeter for the 2 waist readings or the 2 hip readings. The 2 should be less than 1 centimeter difference. Obviously, the waist and hip are going to be different themselves, but the waist, the 2 waist readings need to be within 1 centimeter, and the 2 hip readings need to be within 1 centimeter. Then what you're going to do is you want to divide that number, and that'll give you your waist to hip ratio. And it should, for men, you don't want to be higher than 0.9, and women you don't want to be higher than 0.85. Also, to keep in mind when you're doing it, make sure it's on, when you take the measurement, it's on a natural exhalation, or when you breathe out. So you breathe in, and then you naturally breathe out right when you breathe out. Don't try to out, but once you just breathe out, just naturally breathe out, that's when you'll take the measurement, because it'll be a little smaller. And when you're standing, make sure when you're standing that your feet are close, not touching, but close. So those are three real easy things you can use to help assess and manage while carrying on an exercise program, your weight and body fat percentage with the BIA scale, your blood pressure with the blood pressure cuff, and just a simple tape measure to monitor your waist to hip ratio, just to determine how much body fat you're carrying. It's just a good measurement to use. So those are 3 things you can use that are low cost. Typically, you want to do those if you're starting an exercise program. Do it before, and then once you do it every 3 to 4 months. Just redo one just to kind of check to see where you are. Thanks for your time, guys, and if you have any questions, shoot me an email.